Now we have BA.5, which clearly, because of its ability to evade immune responses, either from the vaccine or from people who have been previously infected, the ability to infect an individual is enhanced over prior variants. So this is something you don't want to panic about, but we really need to pay attention to it.
Dr. Anthony Fauci discussing the latest COVID variant driving a spike in new cases across the country. Here to discuss is the White House COVID-19 response coordinator, Dr. Ashish Jha. It's great to see you again, Dr. Jha. This new BA.5 variant is described as the most transmissible. We don't want to panic, but it is now the most dominant. Deaths are also increasing. So how dangerous is this?
Yeah, good morning, Martha. Thank you for having me back. As you heard from Dr. Fauci, it is the most immune evasive. What that means in practical terms is that if you were infected 3-4 months ago, you can get reinfected. We're seeing high levels of reinfection. We're seeing people who are not up to date on their vaccines have a lot of breakthrough infections. But the good news here, Martha, is that our tools and our vaccines, if you are up to date, if you get vaccinated recently, if you get an infection, if you get treatments, those continue to work really well. So this is an area of concern, but we know how to manage this.
But are those who have been vaccinated, boosted, and have been infected before getting infected at the same rate as those who have not?
Yeah, we're still seeing protection against infection. I mean, obviously, protection against serious illness is still preserved, and that's the good news. But we're still seeing some protection against infection, but not as much. This is that immune evasive nature of this virus. So if you got your booster, let's say last November or December, you don't have as much protection against this virus as you'd like. So one of the key messages coming out of this moment is if you are 50 or over, and if you've not gotten a shot this year, in the year 2022, it is absolutely critical that you go out and get one now. It will offer a very high degree of protection.
You know, I have to say, I've been traveling again this week on airplanes, in airports. So few people wearing masks. And in New York City, where they have a 15% positivity rate, the New York Times described it as kind of a meh reaction to this variant. So what do you do?
Yeah, so first of all, I think it's really important to remind people of the science, the public health science. And the public health science is very clear. If you're in a crowded indoor space, that's especially if it's poorly ventilated, wearing a mask reduces your risk of infection and reduces your risk of spreading it to others. So we've got to continue to encourage people to do that. We've been doing a lot to make testing widely available. It's a really good way of slowing down the spread. And then encouraging people to get, vaccinated and get up to date on their vaccines. And then obviously, as I said earlier, if you end up having a breakthrough infection, getting treated, because we don't want people ending up in the hospital. And treatments are working really well.
And LA County announced this week that if cases continue on the same trajectory, they will have an indoor mask mandate. It looks likely that that will happen. I assume that's something you support. Should other states look at this?
Yeah, my view on this has been for 2 years. Well, before I came into this current role, my view on this has been very clear, which is local jurisdictions, cities, counties, states should make decisions about mask mandates because communities are different and their patterns of transmission are different. That said, CDC has very clear guidance on this as well through their COVID community levels. And the CDC recommendation is that when you're in a high zone, that sort of orange zone, as LA County is, people wearing masks indoors is really important, and it really will make a difference.
What does it say about this virus with all these new variants? What is the future?
Yeah, this is a very good question. The way I look at this is a virus that is still evolving rapidly. We're still in the middle of this pandemic. Now, obviously, we're in a way better place than we were a year and a half ago. For instance, when the president came into office, think about where we were in January of 21 versus now. Much, much better. But we still have work to do. We've got to stay on top of this virus. We've got to keep building new generations of vaccines. We've got to make sure we have adequate treatments. We can get through this, but it is not, if we take our eye off our ball, we've got to really stay focused. And we are, and we're staying focused on managing this.
And just quickly, Dr. Jha, if you can, according to CDC data, about 60 million adults over 50 are eligible for that second booster, but only 1 in 4 have gotten it. Do you think that's because they're waiting for a new booster in the fall, and should they?
Yeah, what I'm recommending is everybody over 50. If you've not gotten a shot in the last 6 months, if the year 2022 you have not gotten a shot, you need to get one now. You still can get a booster, an Omicron-specific booster this fall and winter. Getting a shot now will not preclude you, but it will protect you for the rest of this summer into the fall. I think it's really critically important.
Okay, thanks so very much for your advice, Dr. Jha. Always good to see you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.